Okay, thank you very much, Nusirat. I don't know if you can see my screen in presentation mode.
Yes, we can.
Okay, thank you. So I would like to apologize on behalf of Mr. Omojola. He has some network issues, so I'm going to do my best to stand in for him. And it's been a while I did mammography. I'm in oncology, so let me just make some excuses ahead of time. So yes, as the moderator already said, today's topic is mammography, looking inside the breast. So mammography is one of the diagnostic modalities we have in radiology that enables us to examine the human breast. And in this case, we are talking about the female breast. Okay. So this is the outline. We'll look at what mammography is, why we do mammography, what mammography uses for imaging, the anatomy of the breast, how it works. Then we're going to look at the timeline of the development of the mammography equipment, and finally, what cancer looks like in mammography. Okay, so as I initially said, it's a diagnostic modality. I don't think anybody here has undergone, I might be exaggerating anyway, but if you are probably less than 40 years old, I don't expect that you've undergone this procedure before, but you may or may not have seen it. Most of us might have undergone x-rays, chest x-rays, especially when we are going into school. It's compulsory, you have to do a chest x-ray. So that's a form of imaging technique too that uses x-ray. So mammography also uses x-rays, but it uses low dose x-rays. So the energy is lower than what you'd have in a CT or what you would have in a conventional x-ray machine. So yeah, so this is how it looks like. And this on my left is how the image of the breast looks like when the breast has been imaged using this equipment. So why do we need to do mammography? So is there anything on my screen? Okay, so it says here that because they can detect breast cancer early. So the whole idea of diagnosis generally is that what? Okay, sorry, can you see my screen?
We can just see the introduction slide.
Oh,
We can't
really?
see.
Sorry. Okay, I don't know what. Let me stop sharing and share again.
Okay, thank you.
Oh my God. Okay, sorry, I was using the wrong. Oh my God. Okay, can you see it now?
Yes, we can.
Yes, we can.
Okay, thank you. Okay, so this is what I was talking about. I was saying that this is how the mammography equipment looks like, and this is how the breast looks like once the person has undergone the procedure. This is the image of the breast. And I also said that I want to believe and hope that nobody here, or if you're above, if you're less than 40, you haven't had to do this. For those who are 40 years and above, it's now compulsory. I don't know if there's a law in Nigeria, but in some other developed countries, once you are 40 years and above, you have to undergo compulsorily an annual mammography screening. So I said, why do we need to do mammography? Because it detects breast cancer early. So the whole idea of diagnosis in the first place is we want to be able to catch diseases early and treat them. So like the previous speakers, Mr. Sasu said, we want to detect cancer early. When we detect cancer early, we can treat it early. The patient has a higher chance of, cure and survival. So according to the World Health Organization, in 2020, there were about 2.3 million cases that were diagnosed with over, so half a million of those cases, of half a million of those that were diagnosed died of cancer. So currently in Nigeria, breast cancer is the most common cancer found in women, next to cervical cancer. Men also have breast cancer, but I think it's a very rare disease. So in Nigeria, we have currently about 124,000 new cases every year, and about 80,000 of them die. So I also remember the first speaker saying that in Nigeria, most patients present early. So they're already in their advanced stages when they come to the clinic and say, oh, they have breast cancer. And by then it's almost always too late to treat. We only just palliate, try to extend their lives. But if with a good mammography machine, if they undergo screening regularly, it's easier to pick up this disease early and treat it. So what does mammography use for image? I mentioned earlier that it's an X-ray technique. It uses X-rays. And for physics students here, even if you haven't graduated from the university, we all did physics in secondary school if you studied sciences, and you probably have come across this before. This is an electromagnetic spectrum, and X-rays are one of the radiation we have in the electromagnetic spectrum on the right side. So if the electromagnetic spectrum is arranged in order of increasing wavelength or decreasing frequency, depends on whichever side you are starting from. So you can see X-rays on this side, and they are classified as ionizing radiation. So the energy of the X-rays are high enough to penetrate the body. We actually want this X-rays to penetrate the body and get us an image. So yes, we classify them as ionizing radiation. The energy is high enough to eject an electron from its atom. So I'm sure we all know this formula. Velocity is equals to lambda f, lambda being wavelength and f being frequency. So X-rays have short wavelengths and very high frequency, and we all know that frequency is directly proportional to energy. So that's why they are on that high end of the spectrum. So they use X-rays. That's the whole point of that picture. So the anatomy of the breast. Well, everybody has seen a breast before, at least as a baby. You have seen how a breast looks like. You have a mother, you have a sister. If you are not married, you shouldn't be seeing any breasts. But it's made of, the breast is the organ in the woman's body that produces milk. So they are supported by and attached to the front chest on either side of the breastbone or sternum by ligaments. They rest on the major chest muscle, the pectoralis major. Usually when we are doing exercise, especially if we are doing chest exercises, is the pectoralis major muscle that you exercise. That's actually what pushes the chest up. So when you see men that have very big chests, muscle, you say they have muscle on their chest, it's actually pectoralis major or the minor. So that's the muscle that actually holds the breast up. If you look at it, it's an external organ on the woman's body, or for a man, for example. So this is the picture that shows the breast, the anatomy of the breast, and these are the ribs, the muscles that we talked about, the pectoralis minor, pectoralis major. If you've done anatomy in medical physics, you probably have come across this, the fatty tissue. So the breast cancer can actually develop in any of these areas shown, the breast tissue, even up to the under the armpit, but the lactiferous ducts and the lobes account for most of the cases of breast cancer. All right, so we are looking at how mammography works. So it's an X-ray technique, like I said, just like a conventional X-ray or CT. So it's the same principle. X-rays are generated in an X-ray tube as shown, where fast-moving electrons are emitted from a hot filament, and the potential difference between the cathode, which is the hot filament where the electrons are emitted from, and the anode is actually what causes the acceleration. So you can see the electrons are accelerated towards the anode, and then X-rays are produced. So high energy electrons, they hit the anode, which is an atom that also has electrons orbiting around it, and the high energy electrons eject those electrons in that material. And as we all know, we know the way electrons are arranged orbitally in order of increasing energy levels. So when an electron is emitted, typically from the K shell, so your electron, your orbits are K11, KLMN, in that order, depends on the atomic number of that element. So when an electron is ejected from the K shell, for example, because of the structure of that atom and the rule that guides the orbiting of electrons, another electron from a higher energy level has to go and occupy that vacant position. And in that process, it has to give off that change in energy, because they are arranged in order of energy level. So it's coming from a different energy level to another energy level. It has to emit that difference, that extra. So it does that in the form of that energy that is emitted. We call that X-rays. It could also be that the high energy electrons are passing close to the nucleus, and they encounter some kind of nuclear force that slows it down, that breaks, like when you're matching the brake of your car, it decelerates and it loses energy. We know velocity, energy, we are talking of speed and direct proportional to the kinetic energy. So it loses energy and we call that Bremsstrahlung. So those are just two different ways that they are emitted. But the point is that fast moving electrons hit the anode and generates X-rays. Yeah. So this is how an X-ray tube looks like. This is the picture of how an X-ray tube looks like in reality. This is just one example. There probably, if you go online, probably see other types of X-rays. I don't know what Mr. Omojola was trying. Okay, so this what's it called now? Molybdenum. It's that's the name of the material used to make the anode and the filter. So I'm not going to go deep into that, but in an X-ray tube for mammography, we have different anode and filter combinations. So it could be molybdenum, it could be molybdenum, rhodium, it could be tungsten, rhodium. They all have the reasons why, you know, we have to have that kind of combination. And it provides, you know, high energy, like it affects the quality of the radiation that is being emitted from that. Like I said, I'm not going to go that deep into that, but you just need to know that this is how an X-ray is produced, and these are the basic components of an X-ray tube. Okay, so this is how. Okay, I'm trying to see. Okay, so this is a typical image showing how a mammography scan is done. So up here we have, this is where the X-rays are produced in that tube. This is where they come out from. And then of course you have this shield to shield the face of the woman. Even the person operating the machine too has to be, is standing behind a glass, a lead shielded, you know, to protect him or her from X-ray. Just like the last speaker said, was it a question that somebody asked that, you know, we are talking about using radiation to treat cancer, but radiation is like a two-edged sword. You know, it can treat cancer and it can also cause cancer. So in the process of trying to use radiation from a mammography machine to diagnose a patient, we don't also want to induce cancer in that patient, nor do we want to expose the operator, you know, to the extent where he or she now becomes at risk of developing cancer at a later stage. So this is shielding from the radiation. And then this device is a compressor that is used to compress the breast. And it's also a technique that is used to kind of limit the amount of radiation that the breast is getting to, because we know, okay, I don't think I should go too deep into that anyway, but we kind of compress the breast tissue so that at least the radiation goes in and out, you know, it doesn't, what's the word now? I'm not sure I have the right word to use. Maybe if I remember, I will talk about it later, but it's one way of reducing, like I said, reducing exposures so that we don't have to use too much X-rays. Exactly. Yes, we don't have to use too much X-rays, you know, to image the breast to get a very good image. So yeah, so this slide is talking about the generations of mammography. So how mammography evolved, the evolution of mammography. So we started from an analog unit where the images, I'm sure probably we've all taken images on an analog X-ray machine where you take an image and then the film, you know, they have to go to the lab and process the film and you see it. I don't know if anybody has seen that black film. Okay, so it's an analog unit. We all know, we're all scientists, we know the meaning of analog and digital. So then we progress to a digital unit and a direct digital unit, flat panel. Okay, so that's talking about the detectors. Okay, I get it now. So the film screen is the kind of detector it uses. CR is the kind of detector too. Then we have the flat panel detector. And then currently there is what is called digital breast tomosynthesis. So it's another, it's kind of like getting a series of multiple projections, two-dimensional projections of the breast from different angles to now form an image. Yeah. So this is how. So this is an image showing. Sorry, can you please shut the door? I'm giving a lecture. So this screen is showing the difference between a film image and a digital image, and you can see the difference in terms of the image quality. So for those who are not in the field, it might probably not make sense to you, but this gives a better contrast. The digital one gives a better contrast. So contrast is, if I putting this in layman's terms, is the ability to be able to differentiate between two objects, sitting side by side each other. So we know the breast has lots of tissues, just like the body too. So when you take these images, you want to be sure that, okay, if I'm looking at a liver, if the liver and the spleen, for example, are standing are beside each other, I should be able to differentiate them, So that's what we call contrast, the ability to be able to differentiate between two objects, clearly. I hope I explained that properly. So we can see how the technology has advanced. Before, I mean, just looking at this film, you need to be somebody highly trained. Even me looking at it now, I can't even tell if there's cancer in this breast or not. But the digital one gives it's almost very easy to spot blobs, calcifications, and other anomalies. So this is also explaining again. So look at the 2D image compared to a 3D image. You see how the contrast helps the radiologists who are in charge of interpreting images. They would be able to see this. And of course, it looks different from other structures or other tissues around. So it's easy to spot this. Oh, this looks funny. And then what they would normally do, if they are not 100% sure, because you might not actually be able to say, okay, this is a cancer. So they will go ahead to do a biopsy. So this tissue that's encircled now, for example, they will do a biopsy. So they will extract, that tissue and then take it to the lab and go and check to be sure that, okay, is this a cancer or is not a cancer? It's not a cancerous tissue. So mammography helps us to see this. There are other imaging modalities used for breast, for example, ultrasound, but the contrast is not very good. It's not so even for very young women who are, like I said, below that age of 40. And if the doctor probably suspects that this person has cancer, they won't. Mammography is not usually the first modality that you'll be asked to go and do. Probably do ultrasound, which uses sound, for imaging, so it's not harmful, not like radiation. And then when they now feel okay, they need to do further investigations to clarify if their suspicion of cancer, if they have one, then they ask that person to go and do a mammography. So mammography is like the gold standard of breast imaging. All right. So what does cancer look like in the breast? I'm not a radiologist. I'm a physicist. I don't know. I have to see many images. In fact, I remember when I was like when I was spending some time in mammography for my training, I had to look at many images before I could say that, okay, this is a cancerous tissue or not, because just looking at it, I'm just seeing black, white, gray. And then doctor is saying, oh, Iyobosa, this is a cancer. I'm like, I can't differentiate that. So they are better trained. The radiologists are better trained, to identify. If you work with them, if you're a physicist in diagnostic radiology, you probably have eyes to see this kind of thing. But I don't have those kind of eyes for now. So this screen is saying, so this is DBT is digital breast tomosynthesis, 3D images of the breast with superior image reconstruction. Patient may receive higher dose. So yes, so tomosynthesis is, oh, I wish I could draw. I don't know how to explain it. So like I said, it's like taking several two-dimensional images, projections of the breast. So definitely the patient is going to get be exposed to higher radiation compared to a standard 2D technique, but it gives better image quality. And then, just like this slide says, superior image reconstruction, which allows the radiologist to see and pick up this cancer early. All right, thank you. Thank you. I'm done with Mr. Umojola's slides. I hope I was able to do justice. So if there are some questions, I would answer them. Thank you.